Continuing with Objective 4, we're going to define, pronounce, and spell surgical terms related to the cardiovascular and lymphatic systems and the blood. So first we're going to start out with the terms that are built from word parts. So again, prefix, suffix, word root. So starting with angioplasty, surgical repair of a blood vessel. Atherectomy, excision of fatty plaque from a blocked artery using a specialized catheter and a rotary cutter. Endarterectomy, excision within the artery, excision of plaque from the arterial wall. Pericardocentesis, surgical puncture to aspirate fluid from the sac surrounding the heart, usually to relieve cardiac tamponade and or for diagnostic investigation. Phlebectomy, excision of a vein. Phlebotomy, incision into a vein with a needle to remove blood or to give blood or intravenous fluids, also called venipuncture. Valvuloplasty, surgical repair of a valve, cardiac or venous. Now within the lymphatic system, we have a splenectomy, excision of the spleen. Splenophraphy, suturing or repairing of the spleen. Thymectomy, excision of the thymus gland. And so here is a picture of an endarterectomy. So you can see they are removing within the artery. So here are the little forceps that they are removing. All right, now let's focus on the surgical terms that are not built from word parts. Aneurysmectomy, surgical excision of an aneurysm. Artificial cardiac pacemaker, a battery-powered apparatus implanted under the skin which leads placed on the heart or in the chamber of the heart, used to treat an abnormal heart rhythm, usually one that is too slow, secondary to an abnormal sinus node. Automatic implantable cardiac defibrillator, device implanted in the body that continuously monitors the heart rhythm. If life-threatening arrhythmias occur, the device delivers an electric shock to convert the arrhythmia back to a normal rhythm. Catheter ablation, procedure in which abnormal cells that trigger abnormal heart rhythms or arrhythmias are destroyed by using a device that heats or freezes the cells. Coronary artery bypass graft, and here's a picture of that. Surgical technique to bring a new blood supply to heart muscle by detouring around blocked arteries. So just think of a bypass, in the highway system. If there is a blockage, so you can see where it says occlusion, and you can see like the yellow part, that's the blockage. So they're going to bypass that blocked artery with a artery that is clean, basically. So they're bypassing the blocked artery. Coronary stent, supportive scaffold device placed in the coronary artery, used to prevent closure of the artery after angioplasty or atherectomy, used to treat an artery occluded by plaque. Embolectomy, surgical removal of an embolus or a clot, usually with a balloon catheter, inflating the balloon beyond the clot, then pulling the balloon back to the incision and bringing the clot with it. Femoral popliteal bypass, surgery to establish an alternate route from femoral artery to popliteal artery to bypass an obstruction. Percutaneous transluminal coronary angioplasty, procedure in which a balloon is advanced into a coronary artery to the area where plaque has formed. When the balloon is inflated, the vessel wall expands, allowing blood to flow more freely, also called balloon angioplasty. Thrombolytic therapy, injection of a medication either intravenously or intraarterially to dissolve blood clots. It is often used in emergency departments for acute myocardial infarctions, which are the heart attacks. And then for the blood, we have bone marrow aspiration, procedure to obtain a sample of the liquid portion of the bone marrow, usually from the ilium or your upper hip bone, for study, used to diagnose leukemia, infections, some types of anemia, and other blood disorders. Bone marrow biopsy, procedure to obtain a sample of the solid portion of bone marrow, usually from the ilium, again the hip bone, for study, again used to diagnose leukemia, infections, some types of anemia, and other blood disorders. May be performed at the same time as a bone marrow aspiration. And then bone marrow transplant, infusion of healthy bone marrow cells from a matched donor into a patient with severely diseased or damaged bone marrow. The donor cells may establish a colony of new healthy tissue in the recipient's bone marrow. So now just a few more pictures. Here is a picture of a coronary stent. Again, that definition was a supportive scaffold device placed in the coronary artery used to prevent closure of the artery after angioplasty or atherectomy, used to treat an artery occluded or closed by plaque. And then here is a picture of an automatic inflatable cardiac defibrillator. So again, it's detecting the heart rhythm. So if the heart ever becomes off rhythm or an arrhythmia, it will shock it back. It's just basically, it's the same thing as, when you see on TV, they get the paddles out and they say, clear, and they shock them. Same thing, but this one is actually implantable inside of the patient. Which of the following is performed to remove fatty plaque from an artery? So again, break them down into word parts. These are all built from word parts. So first of all, which of the suffixes mean removal? Well, hopefully you're looking at either B or C because you have ectomy as a suffix, which means excision or removal, and then what word root would mean plaque, fatty plaque, and hopefully you're choosing C for atherectomy. And then here is a picture of a bone marrow aspiration. So they're sticking a needle into the hip bone. I have heard that this is very, very painful. But again, it's used to diagnose leukemia, other infections, and so forth. So they're removing the liquid portion of the bone marrow. So the needle is going through the actual bone. So you can see an up-close picture right here. And that will end this recording.